And amid a record surge in cases, the UK is witnessing a huge surge in hospitalizations. In the latest, the Boris Johnson government has now asked hospitals to identify sites for setting up about 4,000 emergency beds to deal with the fresh wave. According to Britain's National Health Service, the new small-scale temporary hospitals known as Nightingale facilities with 100 beds each will be set up at least 8 hospitals across the country. The Health Service has also asked trusts to identify empty spaces for these facilities in places like gyms, educational institutions. Britain currently has about 90,000 adult, acute and general beds, which are occupied by almost 90%, with hospitalizations rising by almost 70% in the Christmas week itself. On the other hand, England is experiencing a shortage in COVID-19 self-test kits amid the massive surge in cases, and this has led to more people lining up for the PCR test at various centres. The UK reported a record rise of over 183,000 cases on Wednesday, fueling worries over the variant of high concern, and supply shortage of self-test kits during the holiday week has now worsened the situation.
The issue that we have at the moment is that people are going into pharmacies to collect the lateral flow tests for which they have generated a code online, and therefore they are unable to access those lateral flow tests because we simply don't have them. I think the message to the public really is that generating the code does not mean that we have one there sitting ready for you. It's just generating the data nationally so that we know who's collecting them. And it's really important that people, when they do collect them, put that data online as well, and let fill in that form to make sure we're aware of how many are getting negative and positive results.
And in a bid to quell the explosion of cases which might push Britain's healthcare system to the brink of collapse, UK Prime Minister Boris Johnson has urged his countrymen to go for the booster shot and also urged people to indulge in New Year celebrations in a careful and sensible way.
And I'm sorry to say this, but the overwhelming majority of people who are currently ending up in intensive care in our hospitals are people who are not boosted. I've talked to doctors who say the numbers are running up to 90% of people in intensive care who are not boosted. If you're not vaccinated, you're 8 times more likely to get into hospital altogether. So it's a great thing to do. It's very, very important. Get boosted for yourself and enjoy New Year sensibly and cautiously.
And our correspondent Laura Mackin-Isherwood has sent us this report from London. Take a look.
So these are going to be set up at around 8 sites at the moment across England. So hospitals that already exist, that are already taking COVID patients. But these are sort of an extra area of capacity for each of them of around 100 beds to start with, in case they do get an influx of COVID-19 patients who might need some significant treatment for their illness. Now, of course, the NHS, National Health Service bosses are saying that this is basically an insurance policy, a sort of backup to the current space that they have in their hospitals, just in case. But of course, with the sheer volume of coronavirus infections that are being recorded in the United Kingdom day on day, that means that health chiefs really want to make sure that they have that spare space to treat people should they need it.
WION now available in your country. Download the app now. Get all the news on the move.